Cardiovascular system. Cardiovascular system consists of heart. Heart is a hollow muscular organ that lies in thoracic cavity, that is in left mediastinal region. The normal weight of the heart is 300 gram, and the function of heart is to pump blood all over the body. Let's discuss regarding layers of heart. Layers of heart is mainly divided into three: pericardium, myocardium, and endocardium. Pericardium is the outermost layer. Myocardium is the middle layer. It is made up of a smooth muscle layer. And the endocardium is the innermost layer. And there is a pericardial sac which helps to protect the heart from external injuries, infection, trauma, etc. And the pericardial sac is divided into two, that is parietal pericardium and visceral pericardium. The parietal pericardium is the outer covering that attaches to the sternum, posteriorly thoracic vertebra, and inferiorly diaphragm. And next is visceral pericardium. What is visceral pericardium? It is the inner covering adhered to the heart. Pericardial space. Pericardial space is the space between parietal and the visceral pericardium. Means parietal, it is a space between parietal and visceral pericardium, and there is fluid inside, and it is called as pericardial fluid. The normal amount of pericardial fluid is 5 to 20 ml. And the function of pericardial fluid is to maintain lubrication of the pericardial surface. It acts as a cushion. If the fluid exceeds more than 50 ml, then this condition is called cardiac tamponade. Let's move to the chambers of heart. There are 4 chambers in heart, that is right atrium, left atrium, right ventricle, and left ventricle. Left ventricle is the most muscular and vascular area of the heart. Maximum muscle abundant chamber is left ventricle. Right atrium. Right atrium receives deoxygenated blood via superior and inferior vena cava. What right atrium will do? Right atrium will receive deoxygenated blood via superior and inferior vena cava. Then right ventricle. Right ventricle receives deoxygenated blood from right atrium. Left atrium receives purified blood from lungs through pulmonary arteries. What left atrium will do? Receives purified blood from lungs through where? Through pulmonary arteries. Then left ventricle. Left ventricle will receive what? Oxygenated blood from the left atrium. And this oxygenated blood is pumped to all over the body via aorta. And what this left ventricle will do? Left ventricle will pump the blood to all over the body via aorta. Left ventricle is responsible for what? Aortic circulation. And right ventricle is responsible for what? It is responsible for pulmonary circulation. Now let's discuss about the valves of the heart. There are mainly 2 valves. Which are they? They are atrioventricular valve and semilunar valve. What is atrioventricular valve? Atrioventricular valve is the valve lies between atrium and the ventricle. It is the valve lies between atrium and the ventricle. These atrioventricular valves are of 2 types. That is tricuspid valve and bicuspid valve. Tricuspid valve lies in the right side, means that is lying between the right atrium and the right ventricle. And another one is bicuspid valve, or either known as mitral valve. Here this mitral valve is situated. Mitral valve is situated between left atrium and the left ventricle, that is in the left side of the heart. That is all about atrioventricular valve. Next is another type is what? Semilunar valve. Semilunar valve is of two types, that is aortic valve and pulmotic valve. Now we will discuss about the conduction system of the heart. First one is SA node. What is SA node? SA node is sinoatrial node located between superior vena cava and right atrium. Where it is located? It is located between superior vena cava and right atrium. The major pacemaker of heart. It is the major pacemaker of the heart, and the function is to produce electrical impulses at a rate of what? At a rate of 60 to 100 beats per minute. Another one is AV node. AV node is what? AV node is atrioventricular node. Lower side of the atrial septum. It is located at the lower side of the atrial septum, and it will produce an electrical impulse of 40 to 60 beats per minute. Bundle of His. Right bundle branch, and it is the bundle of His is the right bundle branches. Now we will discuss about the coronary circulation. And before that, there is Purkinje fiber, that is below the endocardium. Now we will discuss about the coronary circulation. Coronary circulation means heart gets blood through the coronary circulation. From where heart will get the walls of the heart will get blood, it is through the coronary circulation. This coronary circulation is divided into two, that is right coronary arteries and left coronary arteries. This right coronary arteries is divided into right marginal artery and right posterior descending artery. How this right coronary artery is divided? Right coronary arteries is divided into right marginal artery and right posterior descending artery. Then the left coronary arteries are divided into two, that is anterior descending artery and circumference artery. That's all about the coronary circulation. Now it's moving to heart sound. There are mainly four types of heart sound, that is S1, S2, S3 and S4. S1 is heard while the closure of AV node. When the AV node will close, the sound produced is S1. It is heard at the fifth intercostal space in the middle clavicular line. Where it is heard on the left, on the fifth intercostal space. It is heard on where? It is heard on the left intercostal space in the mid clavicular line, heard over the apex. It is heard over the apex of the heart. Then it is S2. S2 is what? S2 is heard when the semilunar valve closes. When the semilunar valve closes, the heard sound is what? That is S2. It is heard over the base of the heart. That is in the second intercostal left side. It is heard on the left side and in the second intercostal side. Then the S3. S3 is what? S3 is the rarest heart sound which we have. S3. Up to 30 years, this S3 is considered as normal, and after 30, if it is heard, it is considered as ventricular resuscitation. S4 is ventricular dysarrhythmia or ventricular hypertrophy. Due to ventricular dysarrhythmia and due to the ventricular hypertrophy, in some patients we can hear this S4 sound, that sound. Now we will discuss some of the terminologies. In this terminology, first we are going to discuss regarding pulse pressure. What is the pulse pressure? Pulse pressure is the difference between systolic and diastolic pressure. What is pulse pressure? Pulse pressure is the difference between systolic and diastolic pressure. Next is pulse deficit. What is pulse deficit? Pulse deficit is the difference between apical and the radial pulse. Systolic. Systolic means what? When blood vessel contract, the sound heard is called systolic. And when the relaxation of blood vessels occur, the sound is called as diastolic. Then what is stroke volume? Stroke volume is the amount of blood ejected from the ventricle in one beat. In one beat, how much amount of blood is ejected to the in one beat? How much amount of blood is ejected from the ventricle? It is called as stroke volume. The normal is 70 to 80 ml. Now, cardiac output. How we will calculate cardiac output? Cardiac output is equal to stroke volume into heart rate. Okay. Stroke volume is the amount of blood ejected in one beat. This stroke volume into heart rate, what we will get? We will get cardiac output. The normal cardiac output is 4 to 8 liters. Then conductibility. What do you mean by conductibility? Transmitting the impulses is called as conductibility. What is automaticity? Automaticity is a cell capacity to beat by self to generate what? The ability of heart to generate impulses. To generate impulses, the heart's ability to beat by itself is called as automaticity. And what is excitability? Excitability is the response to impulse. It is the response to impulse. Next we will discuss about central venous pressure. What is central venous pressure? The pressure in the superior or inferior vena cava. It is called as central venous pressure. What is the normal CVP? The normal CVP is 3 to 8 mm of Hg or 0 to 15 centimeter of water. What is the normal CVP? Normal CVP is 3 to 8 mm of Hg or 0 to 15 centimeters of water. The normal pulmonary artery pressure. What is the normal pulmonary artery pressure? That is 15 to 30 mm of Hg. The normal pulmonary artery pressure is 15 to 30 mm of Hg. The one cardiac cycle. For one cardiac cycle, how much time it will take? It will take 0 to 8 seconds. Then what is mean arterial pressure? How we will calculate a mean arterial pressure? What is mean arterial pressure? It is the average pressure within the systemic circulation throughout a cardiac cycle. Throughout a cardiac cycle, what is the average pressure within the systemic circulation? It is called as mean arterial pressure. And the mean arterial pressure is calculated through a formula, that is systolic BP plus 2 into diastolic BP divided by 3. How we will calculate the mean arterial pressure? Systolic BP plus 2 into diastolic BP divided by 3. Normally the mean arterial pressure is 70 to 100 mm of Hg.